So today I'd like to talk about one of the commonest things that I see in my clinic, and that is fibroids. So let's start from the beginning. What exactly are fibroids? Well, when you break it down, fibroids at their most basic level are overgrowths of tissue, and they generally occur within the womb itself. If you look at them under the microscope, they're a mixture of fibrous tissue and muscle, and they can develop in different sections of the womb itself. So, for example, on the outer aspect of the womb, within the wall of the womb, or the innermost aspect. And that can really affect the types of symptoms that you may experience. So that's what fibroids are. But what causes fibroids? Why do we get them? Well, like many things, there are several different reasons, and it's really a mixture of some of the background factors that we have, our lifestyle, genetics. Those are the key elements, and of course our ethnicity. Now, it's really important to emphasize that fibroids are really common, and in fact we estimate that about 80% of women will actually have fibroids by the time they are 50. So that's a massive number of women. Now, the main point to note there is that not everyone will experience problems with fibroids. So what types of problems or symptoms can you experience with fibroids? Well, this is a difficult one because it depends on where the fibroid is, and also the number and the size of fibroids. So, for example, if you have what we call a submucosal fibroid impacting on the lining of your womb, then that can affect the heaviness of your periods. You may have heavy, prolonged periods. You might have breakthrough bleeding in between periods, for example. You may also experience difficulty if you're trying to conceive. So that's one area. A second type of symptom may be pain just before your period, or in fact, once the fibroids become bigger, they can actually cause pain throughout the cycle, but they may be more pronounced during your period itself. And that's typical of fibroids that are within the womb lining or on the outer element of the womb itself. And with that, depending on the size and the number of fibroids, you may experience frequency of urinating, so you might need to go to the loo more often. So you can see there's a massive range of symptoms for fibroids. So we've talked about symptoms, but how do we actually diagnose fibroids? Well, like any problem, we'll always sit down and talk through your symptoms first to find out what brought you to see us in the clinic that day and what your main issues are. Once we've narrowed things down, then of course we'll examine you, and depending on the size and number of your fibroids, we might be able to feel them on examination themselves. But really the definitive investigation that we will be looking for to support our suspicion of fibroids is an ultrasound. And an ultrasound will tell us not only where the fibroids are, but how many fibroids you have, and indeed the size of those fibroids. And sometimes we may actually complement that with further imaging, such as an MRI. So we've talked about the types of symptoms, we've talked about investigations. What about treatment? Well, again, this is going to be tailored to your needs. So having the information about your symptoms, what your fertility wishes are, what we found on examination, and of course the results of the investigations will help direct us to the types of options for treatment that you may have. And this can range from lifestyle changes, observing or monitoring your fibroid, right through to thinking about medication. And there is medication now that can help manage your symptoms, or indeed at least temporarily shrink fibroids, right through to actually treating the fibroids themselves, which may be done through a surgical operation called a myomectomy or a transcervical resection of fibroids. So again, these are options that we will go and look at in further detail, depending on what your preferences are and, of course, the type and number of fibroids that you have. So I hope that's been helpful. Just to recap, today we've just focused in on the different types of fibroids, which are really common, their causes, the types and different symptoms that you can get in relation to the types of fibroids, the key investigations we do, and of course the different range of treatment options that we have. I hope that's been helpful, and we look forward to supporting you through your needs.